Hi, I'm Elizabeth. I'm going to be your nurse today. How are you?
Good, how are you?
Good. Can you tell me your name and date of birth?
My name's Autumn Cardenti, June 5th, 1997.
Are you experiencing any pain or discomfort today?
No.
And I see you have glasses. Do you have any other assistive devices?
No.
Okay, before we get started, I'm just going to sanitize my hands. Right now I'm demonstrating infection control. I don't have any jewelry on. I'm making sure my hands are clean. As for safety, the patient's in a chair that's comfortable and secure. There's no hazards in the room, so I think we're ready to get started. So you are alert, so now I'm going to test your orientation. Can you tell me where you are?
I'm at home.
Okay. Can you tell me the date?
November 1st, 2017.
Good. And can you tell me the president?
Donald Trump.
All right. So the patient is oriented times 3. So now I'm going to give you 3 words, and I'm going to have you repeat those towards the middle of, or the end of the assessment.
Okay.
Okay, so your 3 words are going to be mirror, ball, and shoe.
Mirror, ball, and shoe.
Think you can remember those?
Yeah.
All right, so your speech is clear and articulate. That's good. So now I'm going to have you stand up and walk to the window and back. I'm watching your gait right now. All right, that seems to be fluid and steady, no swaying or anything. That's good. I'm going to have you back up a little more. Now I'm going to test your balance.
Okay.
So I want you to take your heel and put it right to your shin on both sides. All right, good. That's not balance, that's cerebellar function. I also want you to do this. Good, and I want you to do this. All right. So your fine and coarse motor skills are intact. Now the real balance test. I want you to close your eyes. All right, and there I was observing for swaying and unsteadiness, and you are good. And your posture also seems to be good. You're not slouching, you're erect, seem to be standing tall. So I'm going to have you sit back down, and now I'm going to move on to your eyes. So right now I'm going to test your peripheral vision. Tell me when you can see my fingers.
Now.
Wow, you're good. Great. All right, now I'm going to test your 6 fields of vision. Do you have any trouble seeing with you now that you have glasses?
No.
Everything's good?
Yes.
All right. Follow my pen. Good. And I want you to follow my pen. Good. The pupils are equal, round, reactive to light and accommodation, and they seem to be running between a 4 and a 5, which is good and normal. Your eyelashes seem to be good, eyebrows good, evenly distributed. Sclera looks clear, conjunctiva looks clear. Just going to peek a little closer. Good. I'm now going to check your facial cranial nerve. So if you could smile for me and frown, puff your cheeks, and raise your eyebrows. All right, cranial nerves seem to be all intact. Can you stand back up for me? I'm going to check your sensation and point localization. So I'm going to have you close your eyes, and I'm going to touch my pen somewhere on you, and I want you to tell me like where I'm touching.
Okay.
Okay.
My left leg.
Good.
My right arm.
Good.
And the right side of my neck.
Good. You can go ahead and sit back down. And do you remember when I told you 3 words?
Yes.
Can you tell me what those were?
Mirror, ball, and shoe.
Good. Perfect. All right. Now I'm going to move on and start looking at your hair. Typically I would put on gloves here, but I don't have any right now. So right now I'm looking through the hair. I'm looking for any lesions or infestations, any abnormalities on the skull. I'm not seeing any. Head seems to be pale, but that's expected. The hair is evenly distributed. It's washed. Looks like she takes care of it. And we are good. Now I'm going to inspect all of her body areas, such as her arms. The pigmentation seems to be consistent throughout. Her skin is moist. It's pink. Her skin turgor is excellent, less than 3 seconds. Cap refill is also less than 3 seconds. I'm not noting any infection, any lesions, any edema. I don't see any ecchymosis or bruising. All seems well. Her nails, can you go like this so I can check for clubbing? Good. Around the nail seems healthy, free of infection, nice and pink, well maintained. Now I'm going to move on to your head and neck. Your head is erect, equal, symmetrical, right and centered in your body. Typically, again, I would have gloves on, and I'm going to palpate the sinuses. Is there any pain here?
No.
Any pain here?
No.
Good. Any pain when I do this?
No.
Good. I'm going to feel for your trachea. Seems to be nice and in the middle. Any pain while I do this?
No.
Do you experience any difficulty swallowing or anything?
No.
Okay. Can you swallow for me? Good. Any pain down here?
No.
No pain in the lymph nodes? Do you ever feel as though they're swollen?
No.
Good. All right. Already checked your sclera and everything. Said your eyebrows are nice and even and distributed. Eyelashes too. So next we're going to move on to hearing. Do you have any difficulty hearing?
No.
Okay. I'm noting 2 piercings on each side. Does this hurt?
No.
Any pain down here?
Nope.
And what about when I poke your tragus?
No.
All right. I'm going to take a look in there. I'm not noting any drainage. They're symmetrical and even on both sides. And now I'm going to perform a whisper test. So
Okay.
I'm going to stand behind you and whisper a word, and I want you to tell me what I'm saying.
Okay. Phone. Chair.
Good. All right. I'm now going to move on to the nose. Equal, symmetrical. I want you to go like this on one side and like this on the other side. Good. Don't see any drainage. Awesome. I don't notice any foul smell coming out of there. How's your smelling? Can you smell things?
Yes, fine.
All right, good. And now I'm going to move on to your mouth. Again, I would have on gloves. I would take a piece of gauze, and I would pull her tongue from side to side and up and down. See if there's any lesions under there. Make sure her tongue is symmetrical. I'm not noticing any strong odor. Can you say ah? Mouth is pink. Mouth is moist. I can see the tonsils. I don't see any signs of inflammation. The teeth look great and healthy. Do you brush your teeth twice a day?
Yes.
Good. Your uvula seems to be centered. Yes, it does. And I don't see any lesions on your lips or anything. How's your taste when you're eating?
Fine.
Good. Do you have any other concerns you'd like to go over or anything?
No, thank you.
Anything else I can do for you today?
No.
All right, thank you.
Thank you.